food?
Well, we might get some entertainment.
That you'll probably get us.
We got an apple.
So, okay, well, I'm glad we got some folks here. So I'm Dr. Campbell. Gonna just give a little spiel on high blood pressure here. Should be good. So, this
Are we
is
just starting or are we finishing?
just starting. So, come on in.
Okay.
So, with many health issues, you have to be able to define it before you know what to do for it. So, to identify high blood pressure, it's not just going to be one reading. So the standard is you want 2 or 3 readings on 2 or 3 different visits. So it's not like you want to have blood pressure checked, 2 minutes later blood pressure checked, 2 minutes later blood pressure checked, and you proclaim yourself having high blood pressure. So it's really got to be on separate occasions because you may be having a bad day, you may have stubbed your toe, or you may have gotten a bad phone call that morning. Days are different, and so it's important to have it on 2 separate occasions. And you always want to make sure, if you have your own blood pressure machine, that you make sure that it's accurate, because unfortunately not all technology works perfectly. So certainly at a provider's office, all of the machines are calibrated every year, so we hope that they're really accurate. So if you have your own machine, it's usually good to make sure that you bring it in. Certainly if we're dealing with you with high blood pressure and working on treatment, we usually really like to have you bring it in to make sure that the readings you're getting at home to monitor are accurate and on track with ours. The other comment I'll make with that is you can get, typically the standard blood pressure machines are either wrist or up on your upper arm. Really recommend up on your upper arm. The closer you are to your heart, the more accurate it is. So, that's always my recommendation if you're looking at getting your own blood pressure machine, get one that goes on your upper arm. So, you get some readings. What's good, what's bad, what point do you worry, what point do you not worry? This becomes part of the problem. You can see all these recommending organizations, and this is a large number of them, but not exclusive. There are a lot of different organizations out there in the US and worldwide that have slightly different recommendations as to at what level of blood pressure reading it needs to be treated. That complicates it for you all. It complicates it for us as providers also, as far as what are we going to follow. And there's a new study, the one on the bottom, the SPRINT study, which I'll talk a little bit about here in a few minutes, that just came out here over the last 12 months that is recommending starting to look at some sort of treatment if your blood pressure is over 120/80. That's pretty strict, which there's pros and cons to that when we're making a diagnosis of high blood pressure, from cost and medications, worry about side effects, insurance coverage. And there are all of these things that have an effect when you're going to put a label of high blood pressure on somebody. So one of the more strict agencies, if you will, as far as cutoffs, is the American College of Cardiology and the American Heart Association. That's what I've got up there on the slide right now. So they proclaim that totally normal blood pressure, normal healthy blood pressure, is less than 120/80. And once you start rising above that, then you're starting in with different levels of high blood pressure. If you're over 120/80, it's elevated. You need to be thinking about some diet changes and some other lifestyle changes to try and start helping with that. If it's over 130/80, again, it's a stage, usually what we consider stage 1 hypertension, and then it goes up from there. That's just one set of recommendations that may or may not be what your provider is going to follow. Out of curiosity, as I've said on the first line, my academy, the American Academy of Family Practice, doesn't follow these guidelines. Their recommendations and what they throw out are a little more lenient, and they are this other organization called JNC8, or at least that was the article that went over the recommendations. They're a little more lenient. They talk about the 140/90, which probably most of you have heard about. Really trying to keep it under that. But it really depends. Those recommendations really depends on how your kidneys are functioning and whether you have diabetes or not. Those are the 2 big factors, and there's an age component on the bottom 2 lines as to at what point are we going to worry about your blood pressure and want to treat that. Okay, so it suddenly starts getting a little more complicated. It's not a real clear cut. Oh, it's got to be less than 120/80. If not, here's a pill. It's a conversation that you all need to have with your provider to help make that decision, given all factors, not just the numbers, but your family histories, your other health issues. Is a water pill, which is frequently our first go-to medication, going to work with somebody who's in a vehicle all day, and not close to bathrooms. That may not be the best thing to do. So it's very specific for each person. So this new recommendation, this study that was done, it's called the SPRINT trial. Again, keep in mind, our recommendations that we get and that we pass on to everybody as patients are based on studies that are done. It's based on scientific studies, and this is just one study. This isn't the end-all, be-all. This is just one study that is now saying maybe we need to have 120 over 80 be our cutoff because we get some added benefits, about a 25% decrease in cardiovascular events if we really ratchet that blood pressure down that low. That probably is going to mean more medicine, higher dose medicine, pros and cons to that. Okay, but there is science that certainly supports driving it that low. The closer you get to 120, the less benefit you're going to get. I mean, are you going to have a huge benefit getting it from 128 down to 118? Not as much as going from 140 to 130. Okay, so it's, again, that's just all of these little gray areas that have to be part of the discussion, ultimately. So what do we do if we kind of say, hey, your blood pressure is too high and we need to try and get it down? Well, first step, ideally, shouldn't be, here's a prescription, go to the drugstore and get it. There are things you can do that don't require medications. We know that if you are overweight, if you lose at least 10 pounds, you can start to see some benefits with your blood pressure, and then more benefits as you lose more weight. So that's one thing that you have power to do. It's not easy, but you have the ability to do that without a prescription. Limiting alcohol consumption. We know that people who are heavier drinkers, we tend to see higher blood pressure issues. Exercise has multiple health benefits, right? It's not just blood pressure, but there are blood pressure, advantages with that. Recommendation is at least 150 minutes a week. Now that can be doing almost an hour of exercise 3 days a week. It can be 30 minutes 5 days a week. It can be, divided however you want. But 150 minutes a week, not all in one time, that wouldn't be healthy for you. Now, I had somebody earlier say, well, how much exercise? How do I know, For me, a good general rule of thumb to where you're starting to burn some calories, starting to really work your heart, is if you're exercising to the point where it's hard to hold a conversation, if you're just walking with somebody, having a nice leisurely stroll, and you can have this full conversation just like I'm doing now, that's probably not enough exercise. I could walk like this for hours, okay? But if you're exercising enough so that you have to stop and catch your breath, that's a pretty good rate of exercise that is going to be doing you some benefits. So that's just a good general way to look at that. So exercise, smoking cessation, and I really should have put on there tobacco cessation, because even chewing tobacco can affect your blood pressure. So if you're a smoker or a tobacco user, then I'm good. Just looking at my time, sorry. Quitting can give you huge benefits, not just when it comes to blood pressure, but certainly other health concerns, cancer in particular. Stress reduction. Easier said than done, I think, for most of us, right? A lot of things that are creating stress in our life we don't have control over, although many times we do. We look at all the things that we're involved with, committees, the activities, the projects we're doing. Sometimes that creates more stress for us. We know the hormones that are involved in our body for stress response, for that stress response, adrenaline and norepinephrine, cortisol, all those things can adversely affect your blood pressure. Sometimes you can look at your life a little bit and say, you know what, I need to get off this committee, I need to stop this project. All those little things that sometimes can help you be a little more stress-free, and that can certainly help your blood pressure. Dietary, there are a couple of dietary things that you can do. One of the biggies that you always used to hear about is salt reduction. For some people that is really effective and can make a difference. Only about 50% of people with a diagnosis of high blood pressure, salt plays a role. So how would you know? You would have to really limit your salt for a couple of weeks, watch your blood pressure, and see if you start to see those numbers going down. So it's not as easy as us just doing a test or a blood test of some sort and saying, oh, you are one who is going to respond if you reduce salt. But certainly salt reduction can help about half the people. We also know that increasing fruits and vegetables and eating higher potassium foods certainly can help drop your top numbers by about 5 or 10 points. So a lot of that is just eating healthier. So those are things that you can do that don't require a prescription that you can do on your own. course, we have a ton of medicines that we can use also. We have a lot out there. This is kind of a busy slide, which really the point of it was, as you go down with the titles, depends on what your health issues are as to what blood pressure medicine we might use. Okay, starting place for many people is a diuretic, a water pill, sometimes we'll call them. It makes you urinate more. So that's the example I use. For some people that might not work in their line of work or anything else that they're doing. But it depends. Diabetics, we use a different category of medicine called ACEs or ARBs. They're very particular in how they work because they help with blood pressure, but they help protect the kidneys in people with diabetes. So people with other forms of heart disease, we might start somewhere else. So we have a lot of medicines. It used to be pretty structured for us as providers to where, if you have an initial diagnosis, start here. If that doesn't work, go here. If that doesn't work, you add this. Very structured. Now we kind of know we have a lot of choices, and it kind of doesn't fully matter where we start. It really depends on, your overall health and what's going on. Cost plays a role in that. Insurance coverage plays a role in that. We've got a ton of new medicines out there that cost an arm and a leg. That's probably not where we're going to start. So the point is we've got a lot of medications that we can use. In the U.S., on average, if you have a diagnosis of high blood pressure, on average you're on anywhere between 2 and 3 different medications to control your blood pressure. If we get even more strict and try and ratchet blood pressure down below 120/80, I'm guessing we're probably going to be 3 to 4 medicines. Is that good? Is that bad? I don't know. It kind of is what it is, but there's ramifications to that, right? I mean, there's potential side effects, there's cost issues, as I said, side effects already said. So, but on average, if you have a diagnosis of high blood pressure, you'll probably be on an average of 2 to 3 pills, or different medicines, not pills. Many pills come combined now. So just to kind of make you aware of that. Some resources that I think are in your little passport book that, if you have more questions about blood pressure, most of the information I got were from these resources, especially, that you can look up and get a little more information. Especially, I think, the top one, I don't remember which one goes over that new trial, that sprint trial, if you were really interested. So as far as just a couple of kind of key points with all of this, again, lots of information we're quickly throwing out. To be diagnosed with high blood pressure, you want 2 or 3 readings over 2 or 3 different times before we kind of start to say your blood pressure is higher than it should be. There are multiple things we can do to lower blood pressure that don't require medication: weight reduction, there's some dietary issues, alcohol, limiting alcohol use, quitting tobacco products, exercise. Those are all things that we as individuals have the power to do on our own. Again, easier said than done many times. And then we have a whole slew of medications that we can use that we would work with you as the individual, depending on what's going to make sense. So that's all I've got. Questions on anything? Real quick before the next session, I can certainly answer anything. Well, thanks for everybody's attention. Hopefully that's helpful. So.